The flushing method, a novel hemostatic technique for endoscopic submucosal dissection under insufflation and saline immersion conditions. Saline immersion ESD can offer advantages such as improved tissue buoyancy and enhanced visualization. However, controlling intraoperative bleeding and achieving hemostasis remains challenging. The EIP2 is an irrigation device that has been reported as effective for bubble removal. Previously, we adapted this irrigation pump to develop the flushing method, which enables effective precoagulation even under saline immersion conditions. Here, we demonstrate that the flushing method using this irrigation system can also be very effective for hemostasis of active bleeding during ESD, both under insufflation and saline immersion conditions. This video presents a clinical case in which the flushing method was successfully applied to active bleeding. To start, we will describe the irrigation setup. In the conventional irrigation mode, the pump is connected to both the endoscope and the electrosurgical unit. Pressing the electrocautery foot pedal initiates water flow through the endoscope channel while simultaneously activating electrical output. In contrast, in the flushing method, the irrigation pump is connected directly to the knife via extension tubing. Using the same interlocking system with the electrosurgical unit, stepping on either cut or coagulation pedal simultaneously activates both electrical output and saline flushing. However, now the saline is ejected from the base of the knife instead of the endoscope. This small difference is key in changing the effects of the electrical output on the tissue. We will now provide an ex vivo demonstration to better clarify the overall system setup. First, the electrocautery unit and irrigation pump are connected via a dedicated interface cable shown here. This allows the two devices to operate in synchronization. Next, we will demonstrate the conventional irrigation mode. In this mode, the irrigation pump is connected directly to the endoscope. When the operator presses the electrocautery pedal, there is simultaneous discharge from the knife and saline jet from the endoscope. Finally, we will show the flushing method, which operates differently. In this configuration, the irrigation pump is connected not to the endoscope, but to the electrocautery knife. When the foot pedal is depressed, the pump again works in synchrony with the electrosurgical unit, but this time releases the saline from the base of the knife. Here, we will demonstrate the effect endoscopically. Under saline immersion conditions, normal forced coagulation creates a vaporization layer of bubbles around the device. This forms an electrical gap and leads to discharge as evidenced by a spark around the needle-type knife. When the video is played in slow motion, the bubbling and spark are more apparent around the tip of the knife. In contrast, with the flushing method, this vaporization layer is instantly cleared by saline flow from the jet of the knife. This suppresses electrical discharge even at high output coagulation settings and enables a more pure coagulation without a spark. Here, we demonstrate that under insufflation conditions, normal forced coagulation naturally causes electrical discharge. Now, applying the flushing method, even under CO2 insufflation, no electrical discharge occurs with the forced coagulation, allowing for a pure coagulative effect. We will now present a clinical case to illustrate the flushing method in practice. This patient is a 55-year-old woman with a 150 millimeter circumferential rectal lesion classified as RB to RS. First, a mucosal incision was made at the anal canal. In this part of the dissection, no blood vessels were observed in the submucosal layer, so dissection was carried out with flushing cut mode. Then, when a prominent submucosal vessel was identified, precoagulation was first performed by flushing coagulation mode. Once sufficiently treated, the vessel is transected using flushing cut mode. When minor bleeding occurs under saline-immersion conditions, hemostasis can be achieved using the flushing method without changing modes. For more significant bleeding, it is effective to promptly switch to insufflation conditions to secure the visual field. Then, by approaching the suspected bleeding point and applying the flushing method, hemostasis can be successfully achieved. The flushing method can even be effective for hemostasis of spurting bleeding under insufflation conditions. En-bloc resection of the tumor was successfully performed without any adverse events. Despite the presence of abundant submucosal vessels, the procedure was completed without the use of any hemostatic forceps. The histopathological diagnosis was adenocarcinoma in adenoma. The carcinoma was confined to the mucosa with no evidence of lymphovascular invasion. Both the horizontal and vertical margins were negative. In conclusion, the flushing method is a novel and effective hemostatic technique that can be applied under both insufflation and saline immersion conditions.